you for coming here today. I'm Russ Kreidel. I'm the president-elect of the Harris County Medical Society. And this is the largest county medical society in the whole United States. We represent over 11,000 physicians. That's approximately 1/4 of the physicians. We're very fortunate that Congressman Kevin Brady has come here today to meet with us here in the Texas Medical Center to discuss with numerous physicians some of the solutions on how to ensure that our country's seniors, and disabled Texans, and military families continue to have access to physicians, because we're meeting a crisis right now, a crisis in reimbursement of the federal government in their Medicare program. What is looming for physicians is a 27.4% cut in Medicare reimbursement. If we look at the chart here, I'm going to ask Dr. Garcia to move to the side, and we look at 2001, we can see the reimbursement levels that we had in 2001. And in the last 10 years, we can see that physicians have had a flat reimbursement from the government. Not even a cost of living increase. At the same time, the 30%, there's been a 30% increase in the cost of doing business for physicians. So they've not even been able to keep up with the cost of running their offices as inflation is taking place. At the same time, we've noted that hospitals, skilled nursing facilities, home health agencies, etc., have all gotten increases from the government. We don't know why we are being selected against, and we're really quite nervous.
Doc, could you say that again? Start where you were. You don't know why you're being selected?
We don't know why we've been selected against in the healthcare arena. Physicians haven't gotten a raise for 10 years, and we're facing a 27.4% cut now. We're the ones who have to deliver the care, not the hospitals, not the skilled nursing facilities. And the problem is that this is making many physicians drop out of the program. We are frightened that some seniors, and we have increasing ranks of seniors now turning to Medicare, are not going to be able to find doctors to take care of them. They may have a card that says they're Medicare covered, but do they have a physician who will accept them? I'd like to introduce Dr. Tom Garcia to you now. Tom is the chair of the Texas Medical Association Board of Trustees, and Tom is going to talk about some potential solutions. But additionally, before we leave here today, I would like you to hear from several doctors here who can describe their personal problems that they've had and the impact this has had on their practices. So we're not going to end before we do that, and I would appreciate you listening to their stories, because you'll see what a crisis we really do face today. Dr. Garcia?
Yes. Well, good afternoon, members of the media, and I do appreciate all of you being here.
Why don't you come over?
Oh, sorry. Good afternoon, members of the media. Appreciate you taking time to come listen to us, because we are very concerned, as Dr. Kreidel has mentioned, going to the solutions that we propose from the physicians. If you notice, the red line is flat right now. With this impending cut, it goes downward. And all the other areas of healthcare are going up. And one of the solutions we're proposing is to reduce the amount of increases that they're having and share with the physicians who are rendering the care to the patient on an upward slope. In addition, the second part of our solution, if you'll allow me for just a minute to get off the mic for just a second, if you'll see that in budgeting for the future from 2011 to 2016, the cost to fix this problem is only going to go up higher. Now, if anyone is interested in budgeting, which it takes quite a bit of time, it's a way of projecting of how you handle a problem as you move forward. Well, one of the things that is going to happen with the OCO, which is what affectionately is money that's been projected to support our war in Iraq and Afghanistan, is going to projectedly go down. We can use that projected budget to help offset this fix, and sooner, rather than waiting for it to be more expensive, we would propose to fix it earlier, so that way our costs are reduced. I know it's initially a simplistic way of looking at it, and another way of saying, well, if it's budgeted, and Congressman Brady will go into that a little bit more in detail, it is at least an approach. It's two examples of a potential solution to a problem to alleviate this continual problem that we're having physicians face every single day. It's my honor and my pleasure to introduce Kevin Brady, Vice Chair of the Joint Economic Committee and Senior Member of the House Ways and Means Committee, the only Texan on the conference committee negotiating a solution for this problem for the doctors of the United States to help pay and help protect the patient-doctor relationship. It's my honor to introduce you, Representative Brady.
Thank you, Doctor, very much.
Yes, sir.
Well, thank you all for being here. And today, we just finished a roundtable for around an hour with our physicians in the Houston region and our leaders of the Texas Medical Association and the Harris County Medical Society, which, as pointed out, is the largest local medical society in America. And this is a critical issue. It's critical for seniors because fewer and fewer doctors can afford to see them at a time in their life when they need to see a doctor who knows them and who they know. It's critical for our local physicians because they are small businesses too. And when Washington continues to delay and interrupt, in some cases just not pay at all, to see local patients, they struggle to keep their doors open. And at the end of the day, Washington not solving this problem, reimbursing local doctors fairly, drives up the cost of health care because it basically pushes our seniors into the highest cost care, which is hospitals or emergency rooms. And so what I'm convinced of is listening to our local physicians. We need a permanent solution to this, to fairly pay our doctors for the long term. The conference committee in the House and Senate go back to work on Wednesday. I'm going to push for a permanent solution to this issue. At the minimum, this committee has to have at least a 2-year solution to it, but even that, in my view, isn't satisfactory because these physicians have, in some years, faced, recent years, 2010, 5 short-term extensions in 1 year. 3 of them, actually, Congress didn't finish its work or the White House on time, had to go back and put it in place. And so I'm convinced that, that this is a real critical issue. Congress needs to act, and the White House needs to act, and they actually have to act right, the right solution. What's been proposed? One idea is to use the savings from the wind down of the ward, which is a budget issue, to offset the cost of this solution, which is also a budget issue. I think could solve some real problems and finally remove this as an ongoing problem. I think it's got real merit to it, studying it right now, but I think I'm going to encourage my conferees to do the same, because I think it could solve this, could be a win-win going forward. And with that, I'd like to hear, I got some real eye-opening comments from our local physicians, some of who are laying off workers, important workers, healthcare workers, some of who are living on borrowed time, taking out loans to keep the cash flow going because they can't count on Washington to pay the bills on time. And a concern overall, too, that we're going to discourage good people from going into medicine and seeing seniors because of the way Washington reimburses, and that's not acceptable. So I'm looking forward. One, I want to thank our physicians for meeting and our medical leaders for meeting with me today, but I also want the public to hear the stories that I've been hearing. Thanks.
Thank you very much, Congressman, and thank you for being a champion of improving health care in the United States, and especially here in Texas. Let me call on Dr. Gilmer, past president of our Medical Society, to share a story with you about his practice. He is a practicing neurologist here in the medical center area.
I'm Bill Gilmer. I'm a neurologist seeing patients, and just today I was a little bit late for this meeting because I was spending time with my patient one-on-one trying to explain to her the pros and cons of having an expensive test done. That's what I do. That's what physicians, the physician component of healthcare, that's what our function is, to talk to patients, figure out what's wrong, and help explain and translate what they need to have done. I'm also one of those physicians that is loaning his own practice money after 10 years of not taking any salary increase and 4 years of my secretary's not getting a salary increase. Now it's gotten to the point where I'm loaning my practice money to pay my payroll. I can't do that. That's just not fair as a small business person for me or an employer. My secretaries and nurses and the people that own the building, they need to match the cost of living. So we're hoping that Congress will help us in getting back to an even keel, at least to where the rest of medicine has been, the rest of the costs of medicine have been.
Thank you, Dr. Gilmer. Now, Elizabeth Torres, would you share some of your stories with us, please?
Thank you. I'm Dr. Elizabeth Torres. I'm an internist in Sureland. I've been in practice over 30 years, and the reason we're here today is because of our patients. They put trust in us, and our Medicare patients are some of the patients I've had the longest relationship with. Some of them over 25 years have had a relationship with one person who I know very well about their histories, and that's what's important to them, that I know them. I love this relationship that I have with them, being able to see them change over time, being able to help them to make the adjustments and changes in their life that they've had to make. And I think that they're very fearful that we're not going to be able to be there for them now that as their years go on. And I want to be there for them. I do this because this is a passion for me, and I love taking care of all of my patients, but my Medicare patients because they remind me of my mom and dad who also have someone taking care of them, and I want to take care of them the same way that I would want my parents to be taken care of. And so I know that each one of these patients is someone's mom or dad, and they're very special to me. And I want to show them that I'm here for them as long as I can be, and they're worried that I'm not going to be because for some reason or other there is this 27% decrease in physician payments, that I'm not going to be able to keep my office open, not just for my Medicare patients, but for all my patients. Since the insurance, other insurers also follow the Medicare fee schedules, and they pay according to the fee schedules, a percentage of that. So my patients are worried that we're not going to be able to keep our office open and be there to see them and continue this relationship that we've started for a long time. And I hope that the Congress will be able to, and the Senate will be able to come together and make some kind of important decision here and how to fix this problem. And I'm here again just for my patients' interest in care. Thank you.
Dr. Torres, you described to us in the other room the fact that you also haven't had a raise in 10 years.
I haven't had a raise since 1993 when I initially started my solo practice on my own. And you know, that part doesn't interest me as much as the fact that I want to be able to grow the practice. And if I'm limited in the income that I make, then I can't grow the practice. I can't get the employees that I need, keep the employees that I need, be able to provide insurance for them. The benefits that I'm able to give my employees make them want to stay in our practice, and our patients see consistent care. They see the same faces, which is comforting when you're feeling ill. And since we don't see these pay raises coming along for our employees, that's certainly a risk that I'm going to lose employees because they may go elsewhere or find another job to be engaged in. And I think that we are going to lose healthcare workers if we're not able to provide them with consistent income or cost of living increases for their pay. So that's very important. As a small business, unfortunately, we have those things that we have to face, the increasing cost of insurance for our employees and their pay raises as well. It's very important because they have families to raise and take care of. And so that's vital that we keep our community alive with the people that we employ, as well as keeping our practice open for our patients.
Another issue is that of equipment purchases and looking toward the future. And some of the larger clinics that take care of Medicare patients cannot plan for the future because they don't know whether the cuts are going to come in today, tomorrow, or not. So do you go out and spend $1 million on a new special scanner, or do you hold off on that because you don't know whether you're going to be reimbursed or not? One of the doctors who was in our group described how they had hired a doctor whose whole purpose was to take care of the Medicare, Medicaid population. And as it exists right now, they had to let that doctor go because he wasn't earning enough money to pay his salary. So there are a lot of problems there. Are there any other members here who'd like to share a story? Dr. Walters?
Sure. My name is Ron Walters. I'm a physician at a rather large academic center here at Texas Medical Center. Let me tell you about, as a result of that, we see a lot of referred patients from outside the Houston area too. Let me tell you about two people that I've seen the last month, and what I'm very worried is a trend that's increasing. After evaluating the person and coming up with the recommendations, some of those recommendations were able to be administered closer to home. One person lived about 190 miles northwest of here, another person lived about 250 miles due west of here. Look of sadness in their eyes. And I said, what's the matter? And they said, well, we understand that we can get this treatments at home. We can't find a doctor who will take me. Both of them were Medicare patients. And you have to put yourself in that situation. You have a serious illness, which is what I treat. You can get the treatment at home. It's something that we can coordinate fairly well, but there's no one to see them. What do? You know, all you can do is say, you're more than welcome to come back here. I know that's a 200, 250 mile drive for you, but we have to deliver the care. So that is increasing, and I would ask anybody to put themselves in that situation of not being able to find a doctor. That's sad. Thank you.
Any other comments from the physicians here? Well, we'd like to open it to questions.
Spanish speaker for Channel 47.
We can read now or later.
¿En español?
Sí, por favor.
¿La presentación completa?
No, de hecho, si usted quiere, pueden irse y podemos hacer la entrevista aparte.
Oh,
Si es
eso
mejor
después.
para todo el mundo.
Tracy, she said that she'd be
It's
happy
okay.
to interview me after
Okay.
everybody
Yes.
else has questions.
And maybe
and
Dr.
Curtis and the
Torres
president.
too.
Are there any questions from the press that's here? that you can answer?
Absolutely, absolutely. Congressman Brady, I've been covering politics for a long time, and I look at that chart and I go, it's like the hospitals and the health agencies had better lobbyists. I know it's not that simple. I know your background. How do we explain, how did this happen? How did the doctors get shortchanged so badly?
I think the ultimate answer is that government has now become the payer of health care for much of America. And by using formulas and projections versus real life costs, they cause problems like this. And for the last decade, my frustration has been the health care discussion in Washington has been all about money and reimbursements rather than patient care at the most affordable cost. And physicians have driven home the point that we will continue to be more efficient. We will continue to invest in our practices and our patients. Yet, Washington has not even kept pace with the cost of inflation for them. And now it's caught up. We really are losing doctors who can't see, they just can't afford to see Medicare patients going forward. We see practices shrinking and jobs being lost because the cash flow isn't there anymore. And as a result, if there's one group in America who needs to see a physician they know and who knows them, it's seniors. And they're losing that access too. So it's time to stop kicking this can down the road as Congress and the White House has done for 10 years or more. And it's time to solve it. This last 2-month extension of reimbursement, in my view, made the problem even worse. And so now it really is time for either a long-term or, in my view, a permanent solution to this.
So this isn't really a Republican or Democratic, it's a people issue. Address that and tell us who you're working with on the other side of the aisle to get this solved.
this is a patient issue, but it really is a healthcare issue too for our local physicians who are small business people. Their ability to survive and practice depends upon Washington actually reimbursing fairly, certainly not cutting them by 27%. This isn't a partisan issue, although again, I was disappointed in this 2-month extension. I thought that was absolutely unacceptable over the holidays. Now we've got to find a way to work together on the conference committee for a permanent solution.
Congressman, given the current fiscal environment, where so many forces will look at any savings from the drawdown to be assigned to deficit reduction, how tough a battle is this going to be to spend that money or to redirect that money towards physician reimbursement?
Well, you have a bit of karma here. Much of the cost of permanently fixing this is in effect paper costs, not real costs because of the rules of budgeting in Washington. The savings from the wars are paper savings as well. You know, so in a sense, you're offsetting what's on paper, the solution for what's on paper and savings. My view is we got to get our budget balanced with real savings and real spending cuts, so there's actual merit in taking this issue off the table, fixing it for physicians and seniors, and removing the temptation to use unreal spending cuts in lieu of real savings at the federal level. So I think there's real merit to this solution that that the more I study it, and I'm hopeful more members of Congress will study it here on the conference committee especially, this could be the solution.
To all the physicians, if I were sitting down with each of you individually, I would ask this question. If you could gather your patients together and talk to them, in an informal manner to express the seriousness of this issue, what would be your most compelling argument? How would you explain this to them in as simple terms as possible? Because we're going to try to explain it to our viewers tonight.
I do that all the time. I tell my patients that if something doesn't happen, and I told them that in December, that I can't see you in January. My cost is about $99 a patient across the board. My office has 50,000 patient visits a year. Approximately 16,000 of them are Medicare, and some of them are Medicaid patients. They pay me less on the reimbursement side than the $99 right now. If they cut it again, it's totally impossible. My patients who can pay the bill are supporting those Medicare and Medicaid patients who we're not getting reimbursed for. So I told my patients in December, we fashioned a letter. We're ready to put out the email. If Congress hadn't acted, we'd say, if you're under active treatment, we'll see you. If you're not under active treatment, I'm sorry, we cannot see you. And that's the discussion I have with my patients.
Can any of you address, maybe Dr. Kreidel could address this, another looming problem are baby boomers. More and more baby boomers coming in. So guys like Greg and I are going to be eligible for
Greg denies it.
I mean, but how do you, boy, you have that, and plus I've read stories where there are just not enough students going into the medical field anymore.
Let me answer. I turned 65 this month. I'm a baby boomer. I was born in '47. I'm right there at the beginning of the baby boomers. My internist said, who I've seen for the last 25 years, 30 years, said, we'll see you because you became a Medicare patient while you were a non-Medicare patient. That internal medicine group, which has 23 physicians, nurse practitioners, PAs, would not have seen me if I had moved to town as a Medicare patient and said I wanted to be seen. Their answer is, no, I'm sorry, we can't see you. So the baby boomers are coming out. If you don't already have a physician, you're in big trouble.
Congressman, I know you respond to your constituents, but when these patients who are facing the potential loss of physician care, when they write to their representatives, are their voices being heard? Do you believe their voices will be heard if there's an outcry, or if the outcry goes greater?
I think the answer is yes. I think more and more lawmakers are hearing from more and more seniors that they can't find a doctor. And they certainly can't find the doctor that they've seen so many years. And I think that is becoming a critical, acute problem. The challenge has always been how to pay for this in the long haul. That still is the challenge. What I do know is we can't keep doing what we're doing as a country in this area. We're damaging seniors, we're harming local physicians, we're driving up the cost of Medicare, for taxpayers as well. So it really is time to come together, Republicans, Democrats, and this president, and come up with a permanent solution.
I've just got one more comment and question. In terms of explaining this to our viewers, most of our viewers are living paycheck to paycheck, and so if they were hit with a 27% reduction in income, they would go underwater quickly. My question is, how many practices do you believe are at the break-even level right now? A majority or
A majority.
At least a majority.
All of them. I represent a large academic institution that cares, that we're involved with roughly half the medical care that goes on in the hospital district. So if anybody has the scale to try to absorb this, yes, small business is the rule in medicine, but big business medicine, whatever you want to call that, there's nobody safe from that. So the backup plans. So when the orthopedic surgeon that you've been seeing for years can't see you next week because of this, well, you've got 2 or 3 more months, maybe because of the scale, but everybody's going to be, this is unsustainable for everybody.
Greg, I think a soundbite or something that might help you, when you see this kind of deficit, when you see this kind of cut, that is the tsunami warning. So if you're on the beach and you hear the siren and you ask someone, what is it? That's a tsunami warning. Which way are you going to run? Up. So this is what we want to do. We want it to go up. Okay? If you can get that to your constituents or somehow, that would be the message I would say.
Thank you all very much.